Hi, it's Dr. David Green, CEO of the Arizona Pain Network. Today's topic are the basics of a procedure called a medial branch block. Now, medial branch block is a very effective procedure that has two purposes. A medial branch block procedure is performed as an outpatient. It only takes about 20 minutes, and on average, it can give about 3 months of effective back or neck pain relief, depending on where it's done. All right, so let me show you on this model where it's done. Okay, so this is the lumbar spine, this is the sacrum, the ilium, just to give you a perspective. Now, these joints are called the facet joints. They have cartilage just like the hip or the knee. They're about the size of a thumbnail, and there's a bunch of them on the left and right sides of the spine. They can get arthritis just like any other mobile joint, and these joints all add up to give us an incredible range of motion of our backs. Okay, so when on an x-ray or a CAT scan, a pain doctor will look and try and figure out in a physical exam where you're having the pain, but it's not always indicative. So a medial branch block procedure is performed for two reasons. The first is therapeutic. It on average gives pain relief, like I said, of about 3 months. And what it does is these facet joints have sensory nerves that go into them so that they can feel pain. If you didn't have sensation to your joints, you wouldn't feel any pain. Okay? So it's not a nerve root. These yellow things are the nerve roots. We're not talking about that. We're talking about these little tiny sensory nerve endings that go into the joint capsule. And what the medial branch block does, and they're called little medial branches, those sensory nerves, the pain doctor injects steroid medication and numbing medicine around the joint, so it blocks. That's why it's called the medial branch block. It blocks the ability of those sensory nerves to transmit pain signals to your brain. All right, so therapeutically, it can give months of pain relief. Diagnostically, if it works, it tells the pain doctor that that level is the source of your back pain. So it may not give 100% pain relief, but if it helps dramatically, then ba-bam, you know that that's the culprit. Okay, so as I mentioned, the procedure is outpatient. It does not take very long. It's very, very low risk because the needle doesn't go around the spinal cord. It doesn't go close to a nerve root. So there's a potential for infection, some bleeding, nerve injury, the usual things that can happen with an injection anywhere. Okay, but the risks are very low with this procedure. Usually you don't need sedation. The pain doctor will numb the skin and the soft tissues down to the area of the medial branches being injected. Now, if the procedure works well and then it wears off, it can be either repeated or you can go on to have what's called a radiofrequency ablation, which is where the pain doctor will put a needle into the same area, and instead of injecting numbing medicine and steroid, they'll actually heat up the tip of the needle and deaden those medial branches. So it doesn't have any motor function, those medial branches, only sensory, and that can give you pain relief for, on average, 15 months. Visit us online today at ArizonaPainNetwork.com. Ton of information, educational about procedures, conditions, treatments. You can see the locations where we have our offices. You can see the doctors we work with, the insurances, and the phone number to call for scheduling. Thank you for watching.